Welcome to the Thyroid Fixer podcast, where we dive deep into the world of thyroid and hormones, especially for you ladies navigating perimenopause and menopause, and really for anyone struggling with hypothyroidism. I'm your host, Dr. Amy, thyroid and hormone specialist and CEO of a global telemedicine practice where we prescribe the right thyroid treatment and bioidentical hormones to all 50 states and most of Canada, helping you become that badass human that you're meant to be. So if you're battling weight gain and hair loss, you can't lose weight no matter what you do, your energy levels are plummeting and your libido left town, then you're in the right place and you have found your tribe. Remember, I want you to embrace every inch of that badass woman that you truly are. So if you're ready to dive in and fix things, let's get started. So I'm at a conference, standing on my feet all day long, in heels, on concrete, talking to people. I'm exhausted. So I decided to take a little walk around this conference. And I find this company, Align. They have these mats out on massage tables. And I start talking to them. I'm like, what are these mats? You know, I've heard of PMF and all of that. She's like, no. These mats are going to actually shift your nervous system. I was like, well, that's great because right now I'm wigged out, stressed out. I'm exhausted. My back hurts, my feet hurt, my legs hurt, everything hurts. I can't focus anymore. I can't hold another conversation. She's like, go ahead and lay down. So I lay down and I figure, if anything, I'm just going to doze off maybe for a little bit. But I kid you not, 15 maybe it was 10. I don't know. Time flew. 10, 15 minutes later, I get up and I just start laughing. I'm like, wait a minute. I feel completely different. Like I feel like I just got 8 hours of sleep. What's going on? And she's laughing and she's explaining this Align mat. And that's exactly what it does. Is it realigns you. So the technology in this mat is like nothing else you will find. It uses infrared heat. It helps to relax the tissues. It promotes actually cellular detoxification. So that's cool. We're clearing out our cells, EMF free. Totally easy. You just throw it on your bed, on the floor, whatever you want to do. You can adjust the heat. You can adjust the frequencies based on what you need. But anything from calming the mind to improving your mental clarity and cognition, that's what I needed. I needed to wake up and be able to think and speak. It reduces recovery time, so muscle repair from injury. And obviously, it helped me big time. I wasn't injured, but man, I was hurting. And then it improves blood flow, tissue oxygenation that had to have been happening that day because I literally felt like a new woman. The really unique thing is it enhances nutrient absorption. So anyone that is struggling with getting their nutrients, maybe you have gut issues or whatever, this is going to help. It's going to help those nutrients absorb into the cell. And then it also accelerates cellular regeneration. So hello, anti-aging. It's an all-in-one mat, so you don't waste your money on this mat and this PMF, and you just get the Align mat, and it literally does everything. It will change your life. I use mine every day now, every day. So you're going to go to myalignmat.com. So that's myalignmat.com. You're going to use the code Dr. Amy. I always give you guys a code because they give me a code for $100 off. So going to save you boatloads of money. And again, you're going to thank me for this one too, because that's what I do. I find you really, really cool stuff and I try it and I bring you only the good stuff that works. We're all trying so hard to get our protein intake up because you hear me say it, you hear other experts say it. You need 1 gram of protein per pound of body weight. But here's the problem. Really hard to eat that much. And the protein powders on the market, oh my gosh, so many of them just taste bad or they bloat you, or worst case, they actually make you gain weight because they're jacking up your insulin. Not a fan of whey protein. I'm not a fan of plant-based protein. I love bone broth-based, collagen-based protein powders, but a lot of them taste like you're eating meat. And who wants that? So enter Power Protein Fixer. This protein powder is amazing. So number one, it blends like a milkshake. It gets nice and thick, whether you're doing vanilla or chocolate, you're going to feel like you're drinking a chocolate milkshake or a vanilla milkshake. If you leave it sit, it poofs up and becomes a mousse. If you blend it with a lot of ice and some nut milk or even water, it will become an ice cream. You cannot beat the taste of this protein. I won't use anything else. I'll use 2, 3, 4 scoops a day to get my protein levels up. So I'm going to challenge you to try it, put it up against any protein on the shelf, and you will always, always come back to Power Protein Fixer. Dr. Allen, I am excited to have you on today because I have not yet in 400 and I don't even know, 60 episodes now, we have not yet talked to a hair restoration specialist. Now, of course, I've done shows that one's called All About Hair, and we'll link to that in the show notes, but it goes over all the different causes that I know of hair loss and hair thinning. And as you know, I'm sure you have a boatload of female clients. It is a really depressing topic. It starts affecting these women. And listen, I've been there too. My hair has broken off and fell out and all that. It really starts affecting you mentally, and it drags you down, and it will cause depression. If you're counting the hairs that come out of your head and taking pictures of the hair and posting it on Facebook saying, please, somebody help me. This is what's coming out of my head every morning. So I'm very excited, as my audience is excited, to learn from you and really find some answers that we can do to save our hair.
Well, it's great to be here with you, Dr. Amy. And you are absolutely right. Hair can be a very emotional organ. And nearly 40% of my patients over the past 27 years have been women struggling with hair thinning, hair breakage, changes in the color, the quality, the texture of their hair, and of course, the volume and the quantity of their hair. So we see it all, whether it's a widening part line or a receding hairline or just some extra strands in the shower or the brush. We know when your hair is looking good, you're feeling great. And when your hair is having a bad hair day and the hair loss continues, it can be a bad hair week and a bad hair life. So, but the good news is that there's a lot we can do about it.
That is good news. That is very good news, very refreshing. So before we get into the treatments, I want to hear from you regarding the causes. Like I said, I've gone over the causes, but can you, in your experience, really break it down for us?
Well, absolutely. You know, there's a lot of causes of hair loss. And what we see in the practice primarily is genetic or hereditary causes of hair loss. But remember that women's hair follicles are very, very sensitive to all sorts of things, everything from stress to hormone imbalance, to your nutritional status, to your sleep-wake cycle. So we take a very 360-degree holistic and functional approach to the hair follicle, which is really a mini organ that demands a lot of energy and a lot of attention in order to produce this beautiful hair fiber, which we hope it will produce very, very well. So it all starts with really the discussion about, well, what exactly is going on? Because sometimes when you say hair loss, people have different ideas. And oftentimes, you know, you may go to your dermatologist, say you got hair loss, and he's looking for a bald spot. And that's not really what most female hair loss looks like. So sometimes you get the brush off, like, oh, get some Rogaine, blah, blah, blah. But so we take a very, very hard and honest look of what the symptoms are, what you're experiencing, when did this start, what's happening in your lifestyle, everything from a special diet to a stressful time, to whether you're working nights and not getting great sleep, to other issues like you've started a new medication. And for women of childbearing age, is it a birth control pill? Or as you get into middle age, is it an antidepressant or a statin drug or a blood pressure medication? You know, all of these things have really, really bad hair loss side effects. And of course, you know, today with the Ozempic and GLP-1 agonist craze, we see a lot of weight loss, hair loss situations happening.
Yeah, with the rapid, and I agree, at those higher doses and the rapid weight loss where people are literally not eating, obviously that's going to be a weight loss, hair loss thing, and then a nutrient depletion. Like you said, are you changing your diet? Well, yeah, if you go from eating 2,000 calories a day to 900 calories a day, that's a diet change because you're just not eating on these GLPs at the higher doses. So, okay, there's so much that you said. I want to unpack a couple of those things because I want to pick your brain on them. Sure. So you said medications. And I believe that even myself, I don't go right there when I'm talking to someone and they're telling me that they're having these hair issues. I never think about, what about the antidepressants? What about the statins? Did they just start on an antidepressant they didn't tell me, or a sleeping pill? So really, those, we'll say, common, very readily prescribed, often Band-Aids that women are given, those can actually directly cause hair loss?
Oh, and no question about it. All of those are linked to hair loss. And even if we just look at, let's say, a statin drug, for example, which is very, very common, statins are important for many different bodily functions, not just your brain and hormone levels and things such as that, but simple stuff like the sebum in your scalp is originated from cholesterol, essentially. And so if you reduce cholesterol circulating in the bloodstream, you might be basically just drying out your scalp and drying out your hair. And sometimes when that happens, the natural sebum production either changes texture or, like I said, decreases in production right off the bat. And then you can get a dysregulation of your microbiome of the scalp, and that can create itching and inflammation. And that's a whole nother, can of worms. Like if you have a scalp health issue, it could be a big problem. But a lot of folks, who are on these statin medications notice that their hair texture changes when they're on that medication. And another common one that we see, as you said, mood modulators, antidepressants, anti-anxiety agents very commonly cause hair thinning. Medications that you may be taking for a great reason, like, for example, your thyroid replacement or thyroid optimization hormones. The thyroid is a very intricate organ that kind of keeps your thyroid level when it's working well. It keeps it exactly at, let's just say, like a thermostat, 72 degrees. It's comfortable. But when you take thyroid medication, you get the spike of thyroid and then it decreases. And I don't think the follicles really like those kinds of shifts, in the body. We're doing it non-physiologically, even when you're trying to replace the thyroid, which of course you need and want for energy and all the other good things that it does. So thyroid imbalance, hypo or hyperthyroid, and then thyroid medication, those are all risk factors. And what makes the situation worse is if you have a hair loss tendency or hereditary hair loss tendency in the family.
Okay. Yep, that makes sense. Now I'm going to ask you something, and I want you to correct me if I'm incorrect in this description. Going back to the thyroid medication, what I've noticed working with women is that, let's say they come in and I always see them in that hypo, low, and slow. They are hypothyroid. They have all the symptoms. They're free T3s in the toilet. Maybe the reverse is high. We don't know, but we start them on the right thyroid hormone replacement. We're giving them Armor. We're giving them some T3. And then they go, oh my God, I'm losing all this hair now that I started thyroid medication, because the thyroid medication caused the hair loss. And I go, well, it's not like a direct cause, unless, of course, maybe you're reacting to a filler in there and you're celiac and you have some gluten or something extreme like that. But when we increase your metabolism is not just the burning of body fat. It's our whole body energy production and systems running. So as we increase the metabolism, are we also increasing that hair growth cycle? So maybe last month you were hypo, low, and slow, and that normal growing phase, dormant phase, falling out phase was slowed down to an abnormally slow level. And now we're bringing up your metabolism. That cycle starts kicking in, and you are counting the hairs that, you're losing now and that you maybe should have lost last month that didn't even come out. Am I right there? Can it tie into metabolism or not so much?
I'm not so sure about that. I mean, look, there's not a whole lot of data on this, to be honest. I mean, we're just talking about my experience in looking at patients and trying to coordinate what's been going on in their lifestyle and their medications and things that we're trying to help them with that might have side effects like hair loss. And just one of the major risk factors, as I said, is thyroid imbalance or thyroid replacement. And even if you do it in a natural and beautiful way, you can still have this hair loss as a side effect. Now, I don't think that the follicles are just, more highly metabolic because you gave them thyroid. If that was the case, then the situation would resolve itself and you would have like all this amazing hair from being on the thyroid medication. That's certainly not the case in the vast majority of patients that I see. So we have to take some action, when you have these underlying issues. First of all, like, even testosterone replacement, for example, too much of it can certainly accelerate the female pattern of hair loss. And so making sure that you're on the correct dose. Obviously you have a very good strategy with your clients and patients, and we have a functional medicine department as well. It takes a lot of care in fine tuning these things, but we can't ignore what the follicle is doing, which is either growing hair or not growing hair, growing a thinner hair, growing a thicker hair. And, part of the evaluation is measuring exactly what's going on in each area of the scalp. So we know whatever changes or no changes have been made to your regimen in 90 days, I'm going to be able to tell you what areas are improved or the same or worse, and by how much. So we'll have a very, very quick feedback loop. If you've made a change to your thyroid medication, or if you've reduced the amount of testosterone you're taking, we can certainly look at what the effect at the end organ, the hair follicle, is, because the powerful tools that we have in the practice enable us to very finely measure and quantify not just the numbers of hairs that are in each zone, but the quality of the hair. So they're actually categorized by the AI powered microscope to the thickness of the hairs, the hair diameters.
Oh, that's interesting. Okay. So that will tell you or kind of guide you into the cause, or does it really not get that narrowed down?
Well, it can give us some inclination as to what's going on. So let's just say, for example, you're coming in for the evaluation. You might have some hair loss in the family, maybe on the mom's side or dad's side, or maybe it seems to be in the men of the family. And you're like, I'm the only woman who's having this hair problem.
Mm-hmm.
Very common. So then we'll do some measurements. We look at the back of the scalp, which is the most relatively permanent zone, unless you've been torturing it with hair extensions, and we'll get to that. The crown area, which is usually the last part to go thin. And then we'll look at the front, which is usually the first part. So we can compare all of those zones to each other. And if, for example, you've got an untouched and well taken care of occipital zone, which is the back of the scalp, and that's significantly higher in density and quality than the frontal zone, then we know you're at risk. And if we're looking in the temples and we see a lot of miniaturized or weaker hairs,
Mm-hmm.
that kind of gives us some inclination that there's some hereditary tendency. Now, when you stack on top of that, oh my God, whole body inflammation, or, hormone imbalance, or you've just started on a new, low caloric intake regimen, whether it's fasting or, or card or whatever it may be, or Zempic, with GLP-1 agonists or something similar to that, then we know that you're going to turn that clock a little faster on your hair loss, and we better do something about it.
How important is controlling stress with the follicle? Because what I found, and I want your take on COVID as well, that was such a stressor on the body. When I had it, I had it bad. I got my ass kicked. And 3 months later, my hair was just breaking. It wasn't even falling off. It was just like breaking off in the middle. And then, of course, I would hear from my patients and they'd be like, all of a sudden, and they might be losing the hair, or it's breaking, or it just went to crap and feels like straw and looks like dry straw. What is that connection? And obviously I'm tying that in with cortisol and stress, because that was a stressor on the body. That viral load was a huge stressor on the body. So what is that connection? And I mean, you can take it from just stress and cortisol, or if you want to
Sure.
tie in viral loads too, you can throw that in.
Sure. So, well, we know, look, stress, you can't escape stress, and stress is a survival mechanism, right? So if you're being chased by a saber-toothed tiger, you want to have that stress response so you can get away. But prolonged stress, whether it's physiologic stress or perceived stress, gives you that excessive exposure to cortisol. And cortisol is one of the quickest way to shut down a hair follicle in a petri dish. And so that's how they do those studies. They drop some cortisol in there and the follicles shut down. So the point is that you're supposed to have increased cortisol in the morning, and then it's supposed to decrease it through the evening and so forth. Obviously, if there's dysregulation there and you've got this prolonged cortisol effect that's going through the evening or even to the night, or you have a spike at night, that's not so good. And there's, a gazillion organ systems that are affected by that kind of exposure. Everything from your digestion to your metabolism to your brain function to your lack of sleep, and of course the hair follicles, right?
Yeah.
And then the physiologic stress. If you, God forbid, you've got COVID and you need to be hospitalized, or even under a general anesthesia procedure that takes time, those are physiologic stressors. You end up in an accident and you're in the ICU for a day or two. Those are physiologic stressors that are going to take a toll on your body. And certainly in the ICU, you're not going to get any sleep. So forget about that business.
Right.
And so stress management becomes really, really important. Now, COVID, we've treated over 1,000 COVID-related hair loss patients in the past couple of years. So whether you had COVID, which is exposure to the spike protein, whether you had vaccination, which again, exposure to the spike protein, there's all sorts of dysregulation that occurs, from your digestion to your circulation to your immune system and your inflammation that goes out of whack to everything that, losing your sense of smell and brain inflammation is a whole nother thing. So we saw from those fevers initially, and then even from just the light little, variant COVIDs, you could start an aggressive shedding phase that happens within a number of weeks, maybe within a month or so.
Mm-hmm.
And the long COVID patients, it just seems to happen again and again and again.
Yeah.
And it just keeps going on and on. And so that effluvium, which is what we call it in the hair loss world, the telogen effluvium, that shedding of hair, can happen acutely or it can happen chronically. And in long COVID patients, you get a chronic shedding. And every time the shed occurs, it just feels like the volume is decreasing, and measurably it's decreasing on the scalp.
Mm-hmm.
So you've got to get action and treat it quickly. The other thing is that the lockdowns, people are shut away from sunlight, from their friends, from their social activities, from their exercise, from the beach. I mean, give me a break. If you want to stress me out, tell me I can't go to the beach. Forget about it, So those are, survival mechanisms that we use to cope with stress. And that was one of the most stressful times that most people have ever been through in their lives. And so whether you didn't get COVID or you did, you were still stressed out because of what was happening, and the lockdowns had this huge detrimental effect psychologically on all of us, depending on where you were in the country.
Yeah.
Obviously, here in Florida, it was a little bit easier for us in a shorter period of time. So, I mean, there's literally now spikeopathy publications in the literature where, people can go and look up exactly how devious and how much, stuff occurs in the body that's detrimental from the spike protein. And they can decide for themselves whether that was a good idea or not.
Yeah, most definitely. Did you see a difference between those who just got the virus versus those who got the vaccination as well?
Well, I'll give you another example here. So a lot of what we treat is not just hereditary hair loss, but sometimes we see autoimmune hair loss as well.
Mm-hmm.
So alopecia areata, which
Yep.
is different from hereditary hair loss, which is androgenetic alopecia. Alopecia areata usually is a small circular area of hair loss where the follicles lose their immune privilege. You get some shedding, and sometimes that area will just respond to nothing. You just leave it alone, just responds to time, and it regrows. Sometimes you have to treat it with corticosteroids. We've done it with PRP. And then other times it can really progress and just almost like you're playing whack-a-mole in these different areas. And of course, in serious conditions of alopecia areata, you can lose all the hair in the top of your scalp and even all the hair on your entire body. So we had patients who we've been treating for many, many years who are in complete remission from alopecia areata, patchy, almost complete total loss. And they were doing fine for 10 years. And then all of a sudden, they get a COVID vaccination and they come in 12 weeks later, small patches occurring. It's starting. What we know, what we have to, we glean from that is that the immune system, something happened when they got the vaccination. Now, did it happen to everybody? Of course not. But these folks probably had some autoimmune sensitivity, and their immune system went completely haywire and crazy with the vaccination. Mm-hmm. And unfortunately, many of them got boosted again and again, and things just got worse for them until finally they're like, enough is enough. Everything was going haywire.
Yeah. You put two
and hair was just the outward sign of it.
Yeah, exactly. Much worse things going on inside. So yeah, I saw that as well. I saw it more with the weight loss, just a complete shutdown. Like, it doesn't matter. You're going to have to ride this wave out because you're not going to lose weight for another 18 months. That's what I had to tell my ladies during that time. So now back to this, the cortisol and the stress. How long after a stressful event will you normally see it start affecting the hair? Is it something that if someone comes to you and it's like, okay, just this week, all this hair loss started, do you test their cortisol now just to take a peek? Or was it really something that happened 6 to 12 weeks ago?
Well, a lot of it comes from the history. And, I'm very traditionally trained where we spend a lot of time talking to patients, find out exactly what's been going on. Like I said earlier, 360-degree holistic approach, I guess, to the hair situation, because we know all these organ systems are interconnected. So, if they told me 6 weeks ago, I started on a night float in the nursing hall, whatever. Obviously, we know kind of what's going on. Or I just got over COVID. It was a month or two ago, and now the shedding is occurring. Or wow, I just started this brand new diet.
Yeah.
And here in Florida, there's lots of them. Obviously, right. Ozempic is the big one right now. If you're decreased, and of course, bariatric patients, we've seen that many, many, many years. This is not a new phenomenon. If you are on caloric restriction, I always tell patients that it's like your nutritional intake then is kind of, it's just triaged differently by the body. And so the body will proportion that nutrition that you take in according to vital organ systems. And unfortunately, even though the hair is a strong emotional organ, it's not really key to our survival at this moment. It probably had more to do with propagating the species, years ago in evolution. Whereas as today, it's just an outward sign of how we're looking and feeling. But of course, if you're on a caloric restrictive diet or malabsorption situation is going on, pretty quickly, your body's going to triage its nutrients in a different way, and you're going to see some shedding occur. Mm-hmm. So the timing is 4 to 6 weeks on average, but it can be different for different people. That's just the average what I see.
Okay, that's interesting.
About the same amount of time like after childbirth. So like you give birth, the hormones crash. So that changes the situation physiologically. The follicles are not then being, bathed in all of this, high intensity female hormone. And then there's that crash. And then usually 6 weeks is when you're going to start to see that shedding, where the ratio of the growing to resting follicles is turning back to normal. And that certainly can release a lot of hair into your brush or drain, as they say.
Mm-hmm. Yeah, exactly. And your hair got nice and thick and luscious during pregnancy. And then you get used to that. And then the post is like, oh, sad face. I'm really disappointed here.
Yeah. Okay. And also don't forget about those fetal exosomes that are being transferred across the placental barrier. You guys are sharing a circulation with a very youthful organism there in the belly, so to speak. And I think that there's some crosstalk between those, those growth factors and exosomes and such that are coming from the fetus that maybe have an impact on your skin and on your hair, in addition to those raging hormones that are going on, to support all of that activity and growth.
Exactly. Oh, that's a good point too. And I totally agree with you there. Absolutely. Now, the nutrition point, we have to circle back to. Talk to me about the importance of protein for the hair follicle, because ladies, and they are notorious for not getting in protein. Maybe it is too much fasting, like you had mentioned, which I am against, because you cannot get in your protein intake during a too long of a fasting window and a short eating window. And then just women in general, they're like, well, maybe I'm getting in like 60 or 80 or 100. And then they track it and they're lucky if they're even getting what they think that they're getting. So talk to me about that importance.
Okay, it's super simple. The hair that you look at is dead tissue. What's it made out of? Keratin protein. So in proline, leucine, those are easy collagen peptides that you can take, put into your coffee if you're fasting or tea. You need protein. So if you're on some vegan vegetarian diet, well, that's all fine and good. You've probably got lots of energy, which is your body telling you probably need to go find some food. But, that's just my opinion on that. But anyway, there are lots of folks that are on those diets that just don't get enough protein. Yeah. And look, can the gorilla survive on fruit? Yeah, of course the gorilla can, but we're not necessarily gorillas. We need protein. And so your hair needs protein. And, if you're deficient in caloric intake, especially protein, you're not going to build hair follicle. You're not going to build hair. Your follicles are not going to create that hair fiber.
So this is something crazy that I learned about electrolytes that I did not know before. Low sodium diets, when you cut back on your salt, can actually contribute to insulin resistance. So number one, we don't want that. We know that is going to definitely increase our weight. Low potassium status suppresses your growth hormone, your anti-aging hormone. And that even just having low thyroid function disrupts your electrolyte excretion. So, if your magnesium is low, we know that that's going to interfere with thyroid T4 to T3 conversion. Now you have this whole electrolyte excretion issues that you're pushing out more electrolytes, but you need to keep them in for that conversion. I'm telling you, the data is crazy on the importance of electrolytes. So I use the OG of electrolyte powders, Element. Number one, because they taste absolutely freaking amazing. I want to use probably too many packets in a day, quite honestly, because I keep putting them in my water because they taste that good. But of course, I also know that I'm getting my balance of electrolytes. And in the summer, I need more. Hey, even in the winter, when I'm skiing and snowboarding, I'm sweating that all out. You need more. So if you want to try some of these amazing electrolytes and actually feel the difference, you will feel the difference. You'll feel more energized. You won't cramp up, and you will get better sleep with this as well. I'm telling you, definitely better sleep. Go to drinklmnt.com. So spell out drink, DRINK, LMNT.com/thyroid. And this is going to save you some money. You can get the sample box. You can try all the different flavors. My absolute favorite, just side note, grapefruit and orange. drinklmnt.com/thyroid.
So the follicle is a very highly metabolic cell population. If, for example, remember, hair grows about 1/3 of a millimeter a day, which is about 1/4 to 1/2 inch a month. You're born with about 150,000 hair follicles on your scalp. So if you have a normal head of hair and you're listening, let's say, to a podcast for about an hour, you've already made about 6 feet of hair in that period of time. So, there's a lot of energy that's being used on a daily basis to make your hair. And you don't want to be, cutting the line short, so to speak. Your hair follicles sometimes are the last in line at the cafeteria of the body, so definitely you want to feed them, not just protein, but there's nutrients and, there's B vitamins and B complex and, making sure that you're, if you need to be on a probiotic to, keep your gut inflammation on track. I mean, these are all really, really important things that you can do. And actually, we have our own system, what's called Wellness System for Hair. These are supplements that I've created that we dial into as needed for our patients who we find are deficient in these things.
Mm-hmm. Yeah, I'm with you with the minerals, even just iodine but especially the protein. The protein and the amino acids are just vital. And I always say that too about the body's survival smartness. And if reverse T3 is elevated. And I use that if you're lying in the ICU or the ER, right? We know that the body is so smart, it's going to shuttle all energy and all nutrients to you surviving. Because at that point in time, it doesn't care if you lose weight. It doesn't care if your hair is pretty. Like it doesn't even care really if you poop every day. All the energy is just going to survival and healing. So the same thing would go for exactly what you're saying. If you are nutrient depleted, mineral depleted, protein and amino acid depleted, it's not going to your hair. There's no way. You're not getting it. So
exactly. And so why do muscles get depleted? Why does minerals get depleted out of the bone, when you're on these diets? It's because your body is looking for that protein and mineral concentration to keep the rest of things going.
Mm-hmm. Exactly. Okay. So now we've moved from problem to solution. Let's start talking about things that we can actually do. And let's start with the bare bones simple of what you like to tell your patients to do or start with. And then we'll go all the way. I'm really interested in hearing about your actual restoration techniques. So start with a simple for me.
Yeah. Well, some of the simple stuff we've already talked about, nutrient supplementation, whether it's a protein, a mineral, a vitamin, things like that. There's certainly herbs that have no side effects that you could use. If you're stressed out, ashwagandha is a great choice. If you have whole body inflammation, you're looking at curcumin, turmeric components, things like that. We can certainly use non-chemical therapies like low-level laser light. Red light therapy is very popular, as you know now, for skin. We've been using it for hair in the practice for over 20 years. And I'll tell you, when I went to medical school more than 30 years ago, they didn't tell us that you could use a light source to create energy in the cell. But that's exactly what happens. Your red light hits the mitochondria, which are the energy centers. You create ATP, which is the currency of energy in the body. And boom, you've got enough extra ATP floating around to help those highly metabolic follicles make more, better quality hair. So low-level laser light, you could do at home. We got the Bauman turbo laser cap. But then we can dovetail into other things too. We want to look at the scalp and make sure that the scalp health is on point. Want to make sure that there's no inflammation, irritation, because sometimes we can see alopecias that can be triggered by inflammation at the level of the scalp. So even just the chronic use of moisturizers on the forehead over time can sometimes cause a problem if they contain certain nanoparticles like titanium dioxide, for example, which can really mess things up. It can create frontal fibrosing alopecia. So looking at these things, extrapolating that from the patient's history and physical exam is really important. And then we dovetail into medications. Obviously, minoxidil is the original hair growth medication that was FDA approved. Most people had kind of a tough time using it as a topical because it was kind of greasy and gooey, but the newer prescription versions are a lot better, a lot less greasy, a lot more user-friendly, a lot less irritating. But now we can also put it into a pill format. So that's been super helpful. These are micro doses, by the way. We don't recommend, just going out to get a mega dose of minoxidil at your local pharmacy. We like to titrate it from a very small dose because we want to watch for side effects as well as measure your hair growth.
Mm-hmm. Yeah, I was going to ask you about the side effects of minoxidil because I know that there are a lot, including like suicidal ideations. So I'm
Not with
assuming that
minoxidil.
that's the high dose, right?
No, not with minoxidil. Minoxidil actually has no hormonal effects, no brain effects. Minoxidil was originally Lonitin, which was a blood pressure medication. So back in the
Okay.
1970s, patients were treated with minoxidil orally because they had high blood pressure. They were on dialysis, let's say, and they had difficulty maintaining a normal low blood pressure. But the problem is that those high dosages caused increase in heart rate and water retention. Not so
Okay.
good. And so those are the main side effects. If you take too much minoxidil, let's say orally, for example, you could get water retention. And that's why we often combine the minoxidil with a mild diuretic like spironolactone, which
Yeah.
also does double duty as an anti-androgen. And we'll get to that. But microdosing minoxidil is not going to tank your blood pressure. But obviously, again, that could be a risk if you go high on the dose. You could have headaches or dizziness from low blood pressure. So, but I think most women are really more concerned about the cosmetic side effects, which is like increased hair growth in unwanted areas.
Oh, yeah.
So if you have hirsutism, you're prone to a little bit of, whiskers on the chin, that type of thing, or your sideburns seem to grow faster than the rest. Minoxidil can sometimes make that worse, especially if you're taking it orally. But if that's the case, there's other things that we can do. The topical versions of minoxidil reduce those systemic absorption. It's just a little bit more difficult. And other things like, for example, finasteride for postmenopausal women has been very successful. I would say about 50% of our patients with hereditary female pattern hair loss get a nice response from the finasteride.
And do you ever use
So
the dutasteride as well?
Finasteride and then
And
dutasteride,
dutasteride.
absolutely.
Yeah.
So just for your listeners, finasteride is the medication that blocks the conversion of testosterone into DHT. So it inhibits dihydrotestosterone production, which is really the trigger for hereditary hair loss, the primary trigger for men for sure.
Yeah.
And in many, if not some, postmenopausal women. So lowering the DHT is a good idea. Dutasteride is a stronger medication for that. And these are, of course, used off label in women because they're not FDA approved for that. But the risk is for developing male fetus. So as long as you're past the years of childbearing age, if your tubes are tied or you're in menopause, whatever, you're not having any more kids, you can use finasteride and dutasteride. Both orally and now topically, we can apply finasteride and dutasteride.
Okay. And block it at the follicle level. That's interesting. Okay. I'll let you keep going. I believe I was thinking of finasteride and men with the suicidal ideations. Is that right?
Yeah, and that's we do hear reports of that, but to be honest, the main side effects for finasteride in men have to do with about a 2% chance of sexual side effects like decreased libido or mild erectile dysfunction. Anything more than that, and they probably have some other thing going on that's predisposing them. But it's never been linked with cancer or suicide. But there are reports and warnings that need to be taken seriously. So always chat with your doctor about that. And that's one of the reasons why I try to ask patients, listen, don't just go to like a cloud pharmacy or your regular derm or your primary doctor. Get a true evaluation from a board certified hair restoration physician. It doesn't have to be me, but get some clear, accurate, well advanced advice on this kind of situation so someone can track it over time and make sure you're doing well on the treatments.
Yeah.
And you know that what the risks and the benefits are. But kind of moving on from the hair homework, which is medications and lasers and nutritional stuff that you would do at home, we have some great treatments in the office that are non-surgical. So treatments like PRP, platelet-rich plasma, have really developed incredibly in terms of their sophistication just over the past couple of years to be able to provide huge amounts of platelets from a small blood draw, 11 billion platelets into the scalp as a typical treatment. We can do it without causing any pain. So no pain with the PRP. We use anesthesia for that. And it creates a very strong boost of hair growth that lasts for about a year if you do it right. And so that's a really nice set it and forget it treatment. If you've got some hair thinning and the follicle's not dead and gone, then you can have a PRP treatment and it can work real well. If you're really needle phobic, the other in-office lunch break type treatment is TED, transepidermal delivery. And so that uses ultrasonic sound waves, literally ultrasonic pressure wave, to break the stratum corneum temporarily, disrupt it, and then push the serums through the skin with growth factors and peptides.
Okay. That sounds
Now that requires more treatments. You got to come in once a month for 4 months to do the TED, but there's no pain, there's no downtime, there's no nothing with TED. You just sit and relax. We say no trauma, no drama
I
with
like
TED.
it. I want to do that
You
on my
know,
skin too. Push the
oh
nutrients.
yeah,
Out.
well,
Yeah.
I'm not the expert at that, but certainly there are people who are pushing all kinds of things through the skin. You could use the TED, transepidermal delivery, to push exosomes now through the skin topically. So that's really, really helpful now. And we're in the midst of a pilot study with one of the more prominent exosome manufacturers out there. So, stay tuned for the results of that. But I think that's working really well.
Okay, that sounds fascinating. Okay, keep going.
These are all things that work like fertilizer in the garden. So that's why the evaluation is so important. We're looking at the follicles. If they're weak or they're at risk, we need to treat them. If they're dead and gone, that's where you're going to need a hair transplant. So hair transplantation is appropriate if the density is very low and you used to have density there, or if you had a high hairline and you want to try to lower it, you can do that with transplants as well. A lot of women come in to my clinic and they've had a facelift or a brow lift or other cosmetic procedure, and they left with some unsightly scarring from that, deep in the hairline that's now becoming more visible.
Mm-hmm.
The scar won't grow hair on its own, but I can transplant hair follicles into a scar and make it grow. So transplants are done under local anesthetic in the office. They take many hours to accomplish. It's a very detailed process, very different than what it was years ago. It's not plugs. It's not painful. We're not taking a strip out of the back of your head. We're going to take each individual graft one at a time and comfortably redistribute that into the thinning or the balding area. And we do it with artistry and care and precision. So you're sitting awake, watching movies, maybe a little relaxed, get up and use the restroom if you need to, take a stretch. Maybe we give you a little bit of medication for relaxation, but we get the work done, harvesting from the good area, the back of the scalp, and implanting into the areas that you need it. And not just for scalp and hairline and temples anymore, but it can also be used for eyebrows and eyelashes and sideburns as well.
Oh my gosh, that's amazing. Because, a lot of women lose their eyebrows just from excessive waxing or even from hypothyroidism. We know the outer corner, but then as we get older, starts affect. That's fascinating. Oh my gosh, this is exciting. So, but you're right. I'm glad you mentioned the plugs because let's face it, that's the first thing that people think about when you say hair restoration or the dudes that you can tell that they got plugs in. And
Right. There's no cornrows allowed anymore. So cornrows, which is the pluggy look, was because the graft size contained 20 to 30 hairs. So think of like your old doll that you had when you were 8 years old. It was like doll's hair. And so by controlling the angle, the orientation, and the position of as little as a single follicle at a time, we can create something that looks completely undetectable and natural. So like I said, for a woman with a high hairline to lower it, or if you have some thinning or receding in the temples and you want to bring it back to a more youthful or more feminine look, that's where transplantation comes into play.
Now, how many treatments does that take? Can you get it one and done?
Well, for many patients, a single session is enough. For others, you might need a little tune-up or densifying it here and there. Look, a lot of women wear bangs over the temple areas, especially if they're receding and they've just been used to wearing that style, and they're afraid to put their hair back in a ponytail. But once they start growing hair in that area and it grows long enough, then they have more flexibility in terms of styling. You can comb it from this way to that way. You can wear it back. You can put a ponytail in for the gym or for tennis or golf or whatever, and you're good to go. But the amount of hair that you need is variable from person to person. Obviously, there's so many different types of hair quality and texture and curl. That some patients do need more than one. It's just the way that it goes. But usually we get most of the way there with a single session, if not all the way there.
Okay. That's not bad though. So will that hair that you transplant respond to the same things that cause the hair loss in the first place, like the stress and medication use and all of that? Or is it, since it's been transplanted, it has a better shot, or will it just respond the same way?
Well, remember that in the earlier part of our conversation, we said we're looking in the back of the scalp, the occipital zone, right near the occipital bone. And we're assessing that area for the quality of the hair. Because if you're experiencing hair loss, we want to know, is it happening diffusely all the way through front to back? And if that's the case, if your donor area is being affected, well, we certainly don't want to transplant that anytime soon. We got to get a handle on what's going on. But the good news is that most women, even if they have extensive hair loss happening in the front, typically around the sides and the back, those follicles are relatively immune to the process of the hair loss. So I guess my point is that it's usually not the soil that's the problem, meaning that area of the scalp can sustain hair growth unless there's some kind of inflammation, obviously. That would be the only exception. But if we take those follicles from the sides and the back of the scalp from an appropriate area that's been identified as strong and good, those follicles will be long lasting and they'll live a very, very, very long time. They're going to be virtually immune to the other hair loss issues.
Okay. All right. Well, that's
but
promising too.
there's one footnote on that.
Okay.
The other hair that's in that zone is at risk. And so it's really important to try to keep that hair growing strong. So that's probably way more important than worrying about your transplants. Your transplants are pretty permanent. They're hardy. They're not going anywhere anytime soon. But it's your other hair that's at risk. And so that's where the other things come into play. Maybe you do PRP annually. Maybe you come in once a month for the TED, a series, or you do it continually. Maybe you need to do the medications or the laser at home. I mean, these are things that you got to build into your regimen, almost like skincare, like your fitness regimen, like doing the crossword puzzle every day or whatever, or Wordle, whatever your thing is. You got to do these things on a regular basis in order to maintain the function of these mini organs over time.
Yes, 100%. I totally agree. Completely agree. Now, let's say someone's listening to this and you just talked about your way of doing this minimally invasive follicular unit extraction technique. That's your technique. What would you tell people? Like, for God's sake, don't go to just the hair restoration clinic down the street. Like, what are the warning signs that people should look out for? Of course, we want them calling you, but if they're like, I'm just going to see what's in my town, what should they look out for?
Well, I mean, look, you're going to probably get a quick education of what's going on in all different parts of the industry. I mean, how do you find a hair restoration surgeon that's qualified is a really great question. You've got to look at credentialing. So I'm American Board of Hair Restoration Surgery certified. That's a certification program. I am a fellow of the International Society of Hair Restoration Surgery. That's the ISHRS. I've also been accepted as the International Alliance of Hair Restoration Surgeons. So that's a third-party organization that was tied to the American Hair Loss Association that looks at different surgeons and basically ranks them or accepts them and says that they're doing safe and aesthetically pleasing surgery. Out there's all kinds of folks doing hair. So today, hair is in big demand. And if you haven't been through a fellowship or preceptorship program and you're just doing hair on a part-time basis, thinking you can add that to your cosmetic repertoire, that surgeon is going to run into some pretty deep problems pretty quickly. And you don't want to become part of that story. So, if your plastic surgeon locally says, oh yeah, I do nose jobs and boobs and lipo, and I can fix your hair at the same time, that would be a red flag, I think. Yeah. You want to find someone who does this day in, day out, consistently, every single day, maybe more than once a day. And you want to find somebody who's doing it for many, many, many years, not maybe like a year or two, or I went to a weekend course. But, I mean, look, in my practice, almost 30 years, 27 years, I've treated over 30,000 patients. I've performed over 14,000 surgeries, 12,000 PRP treatments. I mean, we know, we have an idea of what we're doing. And so are there other great surgeons? Yeah, you can Google the list of top surgeons in the world and find them. But, there's only like 50 on that list. I mean, that's like it. And even the board certification, there's only, is it 50 or 100 of us, 200 at the most, that are board certified. So, you got to do your due diligence. It's time to do your homework. Don't be afraid to travel or do virtual consult. We do virtual evaluations every single day. So before we got on the call today with you, I spoke to patients from all around the world, from Europe to Australia to those right down the block. You definitely want to consult with someone who you've researched and you feel confident in. That's the most important thing.
That's so important. And it sounds like that hair restoration is a very nuanced art. I mean, I say that too about the thyroid. I mean, you need to be working with a thyroid specialist. You need to work with a hair specialist. And with under 200 being board certified, that tells you that they might not be in your town. You might have
that's a great point.
You might have to travel. You might have to do virtual. Yeah, they're probably not in your town.
Yeah. And even your local person who's providing PRP, as we mentioned earlier, maybe they're doing something where you've got to come in like every month for a couple of months, 3 months in a row, and they're doing it without any local anesthetic. Ouch. And they don't even know how many platelets they're providing you or if they're providing any platelets. I mean, these are really important things. If you're going to sit through a process and hope that it helps your hair, you want to make sure that you've got the best chance of success. For sure. And you want to make sure they're spending enough time to talk about all those things that might be influencing your hair. your dermatologist is doing PRP and forgets to ask you about your Ozempic, I mean, oh my God. I mean,
Yeah.
you're going to run into trouble. One of my patients told me this many years ago, and he said, Doc, what you do is a craft. And what he meant by that was that it was a skill, a technique, but it was also extremely artistic. And he said, when you're doing something that requires dexterity and skill and artistry, that's a craft. And so that's kind of the best way that I've been able to describe it to my patients when we talk about what it is that we do in a hair transplant procedure. And, it's not a one-man job, by the way. It does take a team to help me get these procedures completed, but it's one that we enjoy doing.
I love that. A craft. I love that. That's beautiful. That's absolutely beautiful. And for anyone wondering how they can find Dr. Allen, we will put everything in the show notes. He's very active over social, has YouTube videos. So we're going to put everything in the show notes so you guys can connect. Dr. Allen, one last question. This is more for my own knowledge, and I really want your opinion on GHKCU, the copper peptide. My gosh, everything that I read says it's amazing for hair and skin. So very recently I moved, so there's a stressor, but then also I had to find a new hair girl, and she did some kind of K18, 19, whatever treatment on me. And I'm back again to the hair breaking. I mean, just shortness, right? Look at that. So I've been pumping myself with GHKCU every day, crossing my fingers. Does that help? And then what would you say for someone in my situation that's been damaged by a treatment? Are there anything I can do besides wait?
Yeah. So, well, number one, I'm glad that you brought up copper peptide because it's one of our favorite peptides to use for hair. There's some good hair growth studies. There are some indications that it might even help protect pigment or restore pigment in the scalp. Copper peptide has been an amazing wound healing treatment that we've used in conjunction with hair transplants for 20 years. In the practice, we used to dispense this like blue juice essentially for scalp treatments, and the gauze was soaked in the juice, the sprayer had the juice, the gel had the blue, everything was copper peptide.
Yeah.
But once we went to a little bit less invasive procedure, we got away from that rigorous regimen with doing some other things. But copper peptide is in the TED hair serum. So when you come in for the TED treatment, it's copper peptide. It's got a thymosin beta-4 derivative. It has FGF and also VEGF in there, as well as the amino acids that we talked about, proline, leucine, and a dozen or two dozen others, and exfoliants and things like that. So that's included in that. And then I also have a topical peptide that you can use at home, and we call that Pep Grow, GRO. And that's available through the practice as well. So, for example, if you can't tolerate topical medication like minoxidil, for example, maybe it's too harsh, or maybe you don't like the preparation, the aqueous solution or liquid solution that's more water-based of the peptides can sometimes be very, very helpful for patients. So we've had some very nice responses in that regard. So I'm a huge fan of copper peptide. It obviously it appears in my practice in a number of different places. So we enjoy it. Now, for your own hair loss situation, here's what I'm going to tell you, Dr. Amy. Yeah. You need to go to baumanmedical.com and click on schedule consultation. No, just teasing.
And do the TED. I think I need the TED.
Well, here's the thing. So remember, the hair fiber it can't self-repair. So you said to me that you went to the stylist and they did something and it may have caused some breakage. And so remember that, like breaking, like imagine a tree branch cracking off at the last edge. That's what real breakage is. But sometimes people see shorter hairs at the level of the scalp and they call that breakage. Well, that's really just a break in the growth cycle, meaning that the growth cycle's been interrupted and now it's just much shorter and just produces a very, very short hair. So we got to get to the bottom of your situation. So within the next hour, we'll do your evaluation and get to the bottom of all of those stressors that you're dealing with the move, what exactly you're doing to treat your hair and your scalp, what's going on in your lifestyle in terms of sleep and wake and nutrition, and what you're doing to your hair to torture it, whether it be color or straightening or other things.
Maybe.
If you've ever worn extensions, these are things that we need to talk about because, when it comes to extensions too, there's no safe cigarette, you got to move them around and, extensions are great. They look amazing, but they're addictive as crack cocaine, as you've said.
Totally.
So
100%.
You've got to be careful. And then we'll put some therapies and regimens into your homework assignment, so maybe get you a laser light device like the turbo laser cap, get you some nutritional supplementation to make sure your protein is on point. And then we'll take a look at what are the things that we could do on the medical side. So you have to make the trip down to Boca Raton. for
Okay.
the AI powered scalp evaluation and all of the hair measurements that we do to really figure out what's the hair density, what's the hair quality, and what do we need to do in the long run. Do you have some hair loss in the family, mom's side or dad's side?
I don't actually. I have very good genetics that way, but I
Okay.
have hypothyroidism, of course. So yeah, I mean, you're twisting my arm to make me come to Florida. Jeez, I don't know. I think I
Well,
can make it.
we're not too bad. We're about a mile from the Boca Raton five-star resort and club, and about a mile from the beach. But yeah, it's always a nice place to visit. But I would encourage you as well as your listeners to check out baumanmedical.com. There's thousands of pages of information there that I've written personally, hundreds of hours of video that describe all the different therapies and treatments, as well as how we do our diagnostics and information about hair loss there. And of course, even if you just want to ask a question, you go to baumanmedical.com/ask, and you could just type in a question and I'll get an answer out to you. But
Right.
most people will start their evaluation by clicking, schedule consult or schedule evaluation.
Yeah.
And then we can have a more detailed conversation, look at your lab work if we need to, and
Mhm.
all that. And then bring you in like this, down to Boca, drag you
Drag
down to
me
sunny South
down.
Florida.
That's right. All right. Well, that sounds good. See, I wasn't even planning on going over my own issue, but it popped into my head with the GHKCU and what I'm doing. So that was kind of cool. I like that you just walked me through it. It sounds easy enough. So let's just do it. Yeah.
We make it super and easy and painless and comfortable. And on the back end, we're going to get all that hair growing good. Especially if you've got good genetics, that's awesome. That means that you can really get some powerful results from these treatments.
Well, you've given such hope. Like you've literally given these women hope that their hair loss right now is just really ruining their day to day and really affecting their mood. So now I think if you have hope that things can change, you can move on with your day and know that we got you. Dr. Allen got you. So, Dr. Allen, thank you so much for coming on. Like I said before, we're going to put all information, all his links in the show notes. So you guys can find them. No worries. But I greatly appreciate your time and your expertise.
Dr. Amy, it's been great to be with you. And I look forward to doing it again. Get some questions from your listeners.
Absolutely. We'll do it.